Hi, everybody. My name's Jared, and I just wanted to say thank you so much for bringing us into your computer screens today. While it's been kind of a weird year, we really appreciate being able to get in and give back to the community. This one's especially cool for me because I'm a former Meade graduate. So I'm super happy to help with Meade middle schools and Meade high schools any chance I can. So for a bit of background, I am the academic advisor and coordinator for WSU's College of Nursing. The WSU College of Nursing has a long and proud history of education, research, and community outreach. We take pride in consistently graduating some of the best nurses around. So again, thank you so much and have fun with your nursing clip.
Hi, my name is Karina, and I'm in my second year here at WSU College of Nursing. Before we give you our clue and charge you with some tasks, I would love to tell you about how we as nurses assess our patients and work with other healthcare providers to find out what is going on with the patient and how we can best help them. When meeting a patient in a doctor's office setting, we often start by taking vital signs. What do you think of when someone tells you that something is vital? You're right, it means it's important. These vital signs are measurements that are an important tool to help us assess a patient's overall health and may give us a clue as to any possible health conditions a person may have. The 5 vital signs we usually take are the first one that we'll go over is oral temperature. What is it called when you have a high temperature? A fever. Fevers are not in itself a bad thing. In fact, it's our body's way of fighting off sickness. However, it does give us a clue that someone may be sick and we want to investigate further. So, when we take an oral temperature, we use something like this. You may have seen something like this at your own doctor's office or maybe even at home, and you'll get to see it in the virtual visit soon about how we use this oral thermometer. The second vital sign that we take is a pulse. Pulses give us an idea of how well the heart is working. There are a variety of reasons why somebody's heart rate might be higher or lower than we may expect. What do you think happens to your pulse when you are exercising really hard? Yep, it increases. Good job. When we take a pulse, we take a radial pulse, which means we take it right here on the wrist. So if you find somebody's thumb and you move down, we go until we find that you can feel that pulsing in your hand. And we're going to, again, Erin's going to kind of explain as a nurse later about how you may be able to explain this to somebody else and take their pulse. The third vital sign is respirations. So counting respirations gives us a clue into how the lungs are working. Our bodies are amazing. We need oxygen to survive, and our lungs can adapt to increase or decrease the amount of breaths we take depending on the amount of oxygen our bodies need. So for instance, what happens when you are running really hard? Do you breathe faster or slower? When you exercise, your body's working really hard and needs more oxygen. You start to breathe harder because your body is saying, give me more oxygen. Not only do we want to count the number of breaths per minute, but we also kind of want to look at how they're breathing. Does it look like it's hard for them to breathe? Are they taking quick, shallow breaths? Or are they taking slow, deep breaths? Or does it seem pretty easy for them to breathe? So we want to be paying attention to these things. But when we take respirations, and same with pulse, we want to watch or feel for 1 whole minute. And with the breaths especially, you want that person to be relaxed. You look at your watch and you just count for 1 minute how many respirations they're taking or breaths they're taking. The fourth vital sign that we take is blood pressure. Blood pressure measures the force of your blood pushing against the walls of your arteries. Your heart pumps that blood into the arteries, and then your arteries carry the blood out to the rest of your body. Once again, there are a variety of reasons why somebody's blood pressure might be higher or lower. But when they do, that again gives us a clue that something else might be going on, and we want to continue to investigate. So, because I don't have anyone else with me today, I have a short video I'd like to show you about how to take a blood pressure.
Like I said, we're going to inflate to about 180 millimeters of mercury. Then we're there, and I'm going to slowly release, open my valve where it goes down at least 2 to 3 millimeters of mercury, just slowly. And what I'm doing is I'm listening for that first beat. That first beat will be our top number, which will be our systolic. And I'll tell you when I've heard it. We're passing 130, passing 120. And I just heard it just now at the 110 mark. I'm still hearing it. Still hearing it. And notice how it's ticking. See it little moving up and down. Okay, and then it has stopped. It stopped at 62. So 110 over 62 is his blood pressure, and I've slowly let the air out.
All right, so that's just a quick glimpse into how we can take a blood pressure. Again, I encourage you the next time you maybe go in for a doctor's appointment and they take your blood pressure, you can ask them further questions or just pay attention to what they're doing. Wish we could show you in person, but that's the best we got for today. Okay, and one other note on that blood pressure, you notice that she said one number, it's the upper number, and then the lower number. The upper number is called the systolic pressure, and that is the pressure against those arteries when our heart is contracting or when it's beating. And then the lower number is the pressure against those artery walls when it is relaxed. So that's kind of what those two different numbers mean. So the fifth vital sign that we take is oxygen saturation. Remember how I said that oxygen is really important for our survival? Oxygen saturation helps us to know how much oxygen is in your blood. Once again, I don't have the little gadget that we use to take oxygen saturation, but I have a short clip that I will show you.
In pink. So we'll turn on our device and we will place it on the finger and let it get a reading. And here the patient's oxygen saturation is 97%. A normal oxygen saturation is anywhere between 95 to 100%. And below you can also see the heart rate as well, but here in a moment we will actually check the heart rate. And then you'll just want to remove the device.
Okay, perfect. Again, that's a short little video since we weren't able to show you in person, but you will notice, or you did notice, that also measures, so it measures the oxygen saturation, but it also can tell you the pulse. But we still like to feel for those pulses and take the radial pulse as well. All right, that's it for vital signs.
Hey guys, my name is Erin, and I'm also in my second year of schooling at WSU College of Nursing. Now that we've learned some about how to take vital signs, I want to give you a tool that we use to find out why a patient is visiting the doctor and to get a history of their present illness, what brought them in. So after I explain this, you'll get to see an example of how we can apply this information to your current patient, Sally. So when we're trying to learn more about a patient's symptoms, we use what we like to call the Holy 8+1 tool. In other words, we ask 9 important questions. The last time you went to the doctor, you probably heard them ask you these questions. You just probably weren't really aware of it. So we're going to go through these questions one at a time. The first one is called onset. So they'll ask you, when did you start feeling this way? When did you start getting pain or something like that? The next question is going to be location. Where do you experience this pain? Is it in your chest, your legs, your head, your throat, your stomach? Something like that. And they might ask you to point to it rather than just describing it, because that gives us a better idea of exactly what you feel. The next one is going to be called quality. We want to know what it feels like. So is it dull? Is it an achy pain? Is it super sharp like a knife? And we want to get the patient to give us those terms rather than giving them options, because then we'll get a best idea of exactly what they're feeling. The next one is we want to know quantity. So how intense is your pain? So if you've ever been in the hospital before, you've probably heard them ask you to rate your pain on a scale of 1 to 10. And that scale is At a 0, it's not very bad, kind of doesn't hurt at all. And 10 is going to be the worst pain you can imagine. So we want to have people rate it on that scale. Is your pain a 5? Is your pain a 3? And that helps us understand how to treat you and how to help you. The next one we want to know is kind of 2 and 1. It's called frequency and duration. How often do you feel this pain or this difficulty breathing or whatever it is? And when you do feel it, how long does it last for? Is it just really quick come and go, or do you feel bad for hours and hours and hours? So we want to know that. Next, we have kind of some big words, aggravating and alleviating factors. So aggravating is going to be, what do you do that makes it feel worse? So when you go for a run, does your knee suddenly start hurting? That run is going to be your aggravating factor. Then we want to know what helps you feel better. So maybe you come home from your run and you put ice on your knee and then it starts feeling better. That ice is going to be your alleviating factor. Next, we want to know any associated symptoms. So once your knee starts hurting, do you get anything else that happens too? Maybe your ankle's also hurting, or you feel really tired, or maybe you've got some tingling in your feet. Those are going to be associated symptoms, and that's really important to help us understand what else is happening. Because a lot of people can get pain, but if we know those other things, that can help us figure out exactly what's happening so we can help you. Next question is going to be what we call course. Has this gotten better since you first started feeling the pain, or has it gotten worse? Maybe you've been having pain for a couple months, and every time you get the pain, it feels a little bit worse. That's really important for us to know. Our last question, kind of our +1 bonus question, is why do you think you're having these symptoms? Sometimes our patient can tell us more than anything else can about why they think it's actually happening. So after we've taken these vital signs and asked these series of questions, we have a lot of information that we can use to work with the other healthcare providers to try and diagnose and treat these patients. As nurses, we can't diagnose patients, but we play a really important role in assessing their symptoms and collaborating with the other providers. So now it's time to see what this might look like in a virtual visit between a nurse and your patient, Sally. So I'm going to play the nurse in this simulation. So, hi, Sally. My name is Erin, and I will be your nurse today. How are you feeling?
Hey, Erin. I'm doing okay now, but I was feeling pretty bad earlier during practice.
I'm sorry to hear that, Sally. I'd like to ask you a few more questions about that in a minute. But first, we're going to work together to get some vital signs like your temperature and pulse. Is that okay?
Sure, the nurse at school said that you would need that. So I have the thermometer right here.
Excellent. Looks like you're prepared. Well, I'm going to have you start by taking your temperature. So I want you to take that thermometer, take off the cover, and then you're going to put it in your mouth. I want you to lift up your tongue, put it underneath your tongue, and then close your mouth down on it. And we're going to wait until it goes.
Okay, it says my temperature is 98.7.
Excellent. That's a normal temperature. I'm glad to hear that. Next, I'm going to have you take your pulse. So as we showed the students earlier, when you take your pulse, I'm going to have you take your hand, find your thumb for me, put your fingers down into the groove right underneath your thumb. Can you feel the pulsing there? Okay, I'm going to have you look at your watch and count how many times you feel that pulsing in a minute. We're going to fast forward.
Okay, so it seems like my pulse is 70 right now, but I feel like it was a lot faster at school today.
Yes, your school nurse sent me the pulse that she took on you during your practice today. It looks like it was 110 beats per minute then, which is pretty fast. She also sent me your blood pressure, your respiratory rate, and your oxygen saturations from earlier during your practice. Looks like your blood pressure was 116/76, so that's pretty good. Your respiratory rate was 34 breaths per minute though, and your oxygen saturation was 98%. So I've been watching you breathe while we've been talking here, and I counted that. It looks like your respiratory rate now is about 16 breaths per minute, and it looks like it's pretty easy for you to breathe. Is that true right now?
Yeah, for right now it is, but earlier at practice it was really hard for me.
Okay, do you have any other questions about those numbers before we move on?
No, the school nurse explained it to me pretty well earlier.
Awesome, I'm glad to hear that. Now I'd like to ask you a few questions about what's bringing you in today. When did you start having that tightness and trouble breathing in your chest?
Well, I first started feeling tightness last year when I was exercising really hard, but then it went away over the summer. It started back up again this year when we started soccer training, and now I get them at pretty much all my practices and games.
I'm sorry to hear that, Sally. That sounds like it must be really frustrating for you. Can you tell me a little more about where you get that tight feeling? Can you point to that for me?
It's mostly right here in my throat, but I get it sometimes in my chest too.
Okay, thanks for showing that to me. Can you tell me what it feels like when you get that tightness?
It's really scary. It's really tight, kind of like someone's choking me, and I have a really hard time breathing.
That does sound scary. I'm sorry to hear that, Sally. How hard would you say it is for you to breathe? We're going to use a 0 to 10 scale, where 0 is really easy to breathe and 10 is impossible to breathe. How hard would you say it is for you to breathe?
I'd say maybe a 7. It's really hard to breathe, but I still can.
Okay, so how often are you having these symptoms? And when you have them, how long do you feel like they typically last?
Well, I've been getting them a lot at my practices and games, so I'd say like 4 to 5 times a week. I normally feel better after a few minutes when I stop playing and really try to focus on getting better.
Okay. Do you feel like there's anything special about the games that you felt like this that might have made it worse?
I know that I get it more if it's a really close game and I'm stressed that we might not win. I also work really hard then to make sure that we do win, and then I tend to get it really bad.
Okay, so when you're working really hard, it's more likely to happen. You said that you focus on getting better. What is it that you do to get better?
I take a break from playing and then try to breathe really slowly and deeply. Coach said that I need to calm down, and that helps me some too.
Okay. And is there anything else that you hear or feel when you're getting this tightness and trouble breathing?
Yeah, I often hear this really weird, loud wheeze when I'm breathing. Oh, and I also had heartburn once during a bad game as well. It was a really close game, and I was working so hard. We did end up winning, though.
Awesome. Glad to hear you were still able to win it. That's good. So, do you feel like it's getting easier for you to breathe, or is it getting harder as your soccer season keeps going?
Oh, it's definitely getting harder. I felt just a little bit of tightness last year, and now it's like really hard to breathe.
I'm sorry. Do you have any ideas why you think you might be feeling this way?
Well, I figured at first that I was just working too hard because I love soccer, but now I think there's something really wrong with me. Do you know what it is?
Well, I'm going to talk with the doctor about those things that you've shared with me today, and we'll see if we can figure out what this is with you. Um, I don't know yet, just based on what you told me, but you gave me some really good information. So we want to help you start feeling better. So thank you so much for talking with me today.
Thank you. Thank you for watching that virtual visit. I hope it gave you some more information and you learned about, vital signs and the questions that we ask our patients when they come in to see us. Now we'd like to charge you with the task of practicing some of the skills that we showed you today. So I know that you are at your homes. If you can find a friend or a family member that you're able to practice those pulses and counting those respirations, I think that would be great. Remember to count for a full minute and do it as many times as you want to get all the practice in. Thank you so much.
Hi, guys. Thank you for working with us today.
Thank you so much to the Coug nurses. I learned a lot, and I hope you guys did too. Good luck using the new detective skills that you were taught today and getting to the bottom of this medical mystery. And maybe one day we'll see you walk in the halls of WSU's College of Nursing. Thank you so much.